In the name of Almighty Allah, I am Tawseef Iqbal, and today we will discuss about a general sense and abilities paper of CSS. So I want to explain all of you that I have attempted the past papers of all subjects, especially of compulsory subjects, and my optional include psychology, zoology, governance and public policy, criminology and political science. So I have attempted in detail all of my subjects, but first of all I will explain it in outline form. So this question I have collected from the 2019 exam of CSS, and the question is why an indiscriminate or casual use of antibiotic may prove dangerous. So first of all, what is antibiotics? So antibiotics is a chemical substance which is obtained from microorganism and used against microorganism and effective in low concentration. So the main point is that antibiotics are chemical substances and they are used against pathogenic organisms or microorganism. Anti stands for against and biotic stands for life. So antibiotics are those chemical substances which are used against biotic animals or biotic things. So examples of antibiotics include penicillin, cephalosporin, aminoglycosides, tetracycline, macrolides. All these are the major classes of antibiotics. The most common example which Augmentin 625 mg dose. So Augmentin is the example of penicillin, like that doxycycline, ciprofloxacin, levofloxacin, doxycycline among others. And now what are the danger associated with the casual use of antibiotics? So antibiotics are not candies because one should use antibiotics according to the prescription of doctor and under the supervision of a qualified pharmacist, because uh, are antibiotics are safe if they are used accordingly to a dose, according to proper medication, according to proper course. But if someone do misuse of antibiotics, so they can prove fatal. So the major danger associated with the casual use of antibiotic. So the first thing is uh, resistance develop. So first of all, resistance is the major danger which are associated with the misuse of antibiotics. Suppose if someone have minor infection and they use broad spectrum antibiotics, so with the passage of time, the bacteria or other microbes will develop resistance against that specific dose or that specific antibiotics. So for minor infection, one should use narrow therapeutic index drugs, or we can say minor class drugs. If there is a major infection, so one should go to extended or broad spectrum class of antibiotics. The next point is antibiotics are blind, so destruction of natural bacteria. So there is a normal flora in inside human gut. So antibiotics are blind. So along with harmful bacteria, they can kill um, useful bacteria too. So that's why they cause destruction to normal flora. And the last point is adverse reaction of antibiotics. So mild rashes, um, along with nausea, vomiting, loose motion. So all these problems are associated with the misuse of antibiotics. So inshallah, in next class I will explain in detail how resistance develop, what are the strategies which are used by bacterias. So inshallah in next class I will discuss about that. So thank you. Stay tuned with us. Good luck.